Good morning, everybody. Thank you all so much for coming out for an important announcement today. We're here today to talk about two very disturbing public health trends that we're seeing right now. One is the rise in teen vaping, teens using e-cigarettes. According to a 2018 Kentucky Initiatives for Prevention survey, nearly 1 in 4, 23.2%, Kentucky teens use e-cigarettes every day. What's really alarming about that is that the survey found that e-cigarette use amongst teens nearly doubled over the last 3 years. The other trend is the outbreak we're seeing of people who use vaping products developing serious lung problems. We've seen more than 800 cases nationwide and 12 deaths, and the cause is still unclear. The Trump administration has said it will ban flavored e-cigarettes and vaping products that target and hook our young people. We urge the administration to implement that commitment as quickly as possible. We're seeing state action as well, with states like Rhode Island, Michigan, and New York already enacting similar bans. Additionally, Massachusetts just announced a temporary ban on the sale of all vaping products. I'm proud to say that our city here in Louisville recognized and took some action on the dangers of e-cigarettes years ago, particularly the dangers of their use in public spaces. That's why in 2017, Louisville included e-cigarettes and hookah products under its smoke-free ordinance. The ordinance now prohibits smoking, vaping, and the use of hookah products in all indoor public places and work sites. As a result, anyone witnessing a violation of the ordinance, which is seeing someone vaping or smoking in an indoor public place, can report it by calling Metro Call 311. Today, Louisville has one of the strongest smoke-free ordinances in the country, but it's clear that we have more to do to protect the health of our children and the health of our community. That's why I'm directing my staff to immediately explore steps we can take within Louisville Metro government or working with Metro Council or the State General Assembly to reduce the use of e-cigarettes in our community, particularly amongst our young people. To prevent this crisis from getting worse, again, particularly amongst our youth, we have to work together. And we'll continue working on this with our community partners at JCPS, the Foundation for a Healthy Kentucky, and others. I was proud to stand with them in the spring when they announced a statewide campaign to warn kids about the dangers of e-cigarettes and vaping. And my team will stand with them going forward as well. So to talk more about what we're seeing right now in our city, our state, our nation, and our schools, I'm going to ask a few others here to speak, starting with the director of our Department of Public Health and Wellness and our city's chief health strategist, Dr. Sarah Moyer. Dr. Moyer.
So we're here today because of various serious outbreak of severe lung injury associated with vaping and e-cigarette use. This outbreak puts a fine point on what was already a public health crisis, threatening to undo decades of progress reducing tobacco-related illness and death. So as a public health professional, our message is simple. Vaping is not safe. The industry is not regulated by the FDA, and right now there is no way to know if a product you buy in a store are safer than products you buy on the street. Please stop vaping. Parents, teachers, and mentors, it's critical that you discuss this outbreak with your children. Let them know about the life-threatening consequences of vaping and e-cigarette use, and if they're vaping, treat it as a serious medical issue. Help them stop vaping. If you're using e-cigarettes containing nicotine to quit smoking, cigarette smoking, don't return to regular cigarettes. The Department of Public Health and Wellness offers free smoking and vaping cessation classes with FDA-approved nicotine replacement products, such as patches and gum. Please call us at 574-STOP. That's 574-7867. We can help you stop smoking. So here's what we know about the outbreak so far. It's continuing to grow very quickly. As of September 27th, there have been 805 cases of lung injury reported from 46 states, including Kentucky. 12 deaths have been confirmed in 10 states, including our neighboring state of Indiana. And as of September 27th, Kentucky has had 20 cases under investigation, with 3 probable cases and 1 confirmed case so far. And one of these cases we know is from Louisville. So symptoms include cough, shortness of breath, and fatigue, much like a cold. But unlike a cold, these symptoms grow worse over a period of days or weeks, eventually requiring admission to the hospital and even death. So other symptoms may include fever, chest pain, weight loss, nausea, vomiting, abdominal pain, and diarrhea. All cases have a history of e-cigarette product use or vaping. So if you've recently used e-cigarettes or vaping products and you have symptoms like these, please see your doctor or healthcare provider. You may have heard that this has only happened to people who use THC products bought on the black market. This is not true. Investigators have not been able to narrow down the cause of the very serious lung injury to any specific groups of vaping products or substances. Right now, we can't say that there are any vaping products, including those bought in stores, that do not cause this deadly lung condition. And that's why we're advising everyone to stop vaping. As a physician and a public health advocate and a mom of 4 young kids, my goal and my passion is to help people live longer, healthier lives. So the most concerning thing that we know about this disease is that it's primarily affecting our young people. More than 2/3 of those that have gotten sick so far are between the ages of 18 and 34, and another 16% are under 18. Over the past couple of decades, decreased teen cigarette use was a public health win. And in just a few years, the progress we made has been reversed. E-cigarettes have been marketed as being safe, but we don't know that. These products are not regulated by any agency, and we don't know what's in them. And the chemicals that we do know they contain are not safe. As a doctor, I've seen patients struggling to breathe, and the terrified look in their eyes as they realize they can't get any air. I've seen children on a ventilator, unable to speak to their parents sitting helplessly at their bedside table. And as a mom, I don't want to be that parent. And as a public health professional, I don't want anyone to be that parent. So this is what you need to know. Stop vaping. There's no products we currently know are safe. If you've used an e-cigarette to try quitting cigarettes, do not return to smoking traditional cigarettes. Anyone can call us at 574-STOP and sign up for a free stop smoking and vaping class. So before I bring up Ben Chandler, I want to thank my team who's here today for investigating cases and staying up to date on all the latest information and treatment resources. And thank you to the Board of Health for being passionate about this issue and very supportive. And I want to say thank you to Rooney Bhatnagar behind me, who's been a world leader in the research and the health effects from vaping. And so now we'll hear from Ben Chandler from the Foundation for Healthy Kentucky on the efforts being taken to prevent more youth from starting vaping in the first place. Thank you.
Thank you, Sarah. Now that I'm at the podium, I'm going to take this opportunity, Mayor, to compliment you on lots of good decisions since you've been mayor, but one of the better decisions was the hiring of Sarah Moyer as your public health director. About a year and a half ago, the foundation began raising concerns about e-cigarette use by middle and high school students. At the time, the science was indicating that e-cigs might be safer for adults than cigarettes, but it was clear on the dangers of youth vaping. E-cigs contain high levels of nicotine, and because of the way they're made, they deliver that nicotine to your blood and brain much faster than cigarettes. Nicotine and the kid-friendly flavors led to widespread youth e-cigarette addiction nationwide and in Kentucky. And that brings us to today, a point when the growing youth vaping epidemic has now spread into a lung disease crisis that, as Sarah said, is affecting 46 states and has caused at least a dozen deaths. It may seem like the vaping illnesses came on suddenly. After all, it was less than 3 months ago that an 18-year-old woman went to a Wisconsin urgent care center because she was having trouble breathing. She was diagnosed with pneumonia and prescribed antibiotics. Feeling even worse 4 days later, she struggled to walk across the waiting room at her pediatrician's office. She was examined and admitted to intensive care at Children's Hospital. She later recovered and quit using e-cigs, but a dozen other Americans were not so lucky. After that incident, medical professionals began connecting the dots to several other patients with similar symptoms. The only common denominator was e-cigs. The Wisconsin teen may be patient zero in a vaping-related lung disease outbreak that reached Kentucky several weeks ago. While tragic, this outbreak should not surprise us. E-cigarettes are largely unregulated products. No government entity oversees what goes into them. No authority tests them for safety. Some ingredients are approved by the federal government for eating, but not inhaling. They contain nicotine, cancer-causing chemicals, heavy metals, and perhaps thousands of other chemicals that your lungs were never meant to process. They physically change the developing brain, making it more susceptible to other addictions. Many are mislabeled, they are easily adulterated, and they are not even proven effective for quitting smoking. Individual success stories may be encouraging for those who use them to quit, but they're not evidence in and of themselves of effectiveness. The research shows that most smokers who try to quit using e-cigs end up being dual users. The bottom line is that across the entire population, it appears right now that the harms of e-cigarettes outweigh the benefits. At the very minimum, we must do all we can to protect children, teens, and young adults from these products that are so dangerous for them to use. To that end, the Foundation will be seeking 3 measures in the 2020 General Assembly. Our primary focus will be an excise tax on e-cigarettes that is equivalent to the tax on cigarettes. Thanks to Representative Jerry Miller for already pre-filing a bill to do just that. Right now, e-cigs are the only tobacco product sold in Kentucky that is not subject to a state excise tax. Yet, they're the most popular tobacco product for youth. Only 8% of Kentucky adults use e-cigs, but 26.7% of Kentucky high school students use them. The second measure is increased funding for prevention and cessation. This year, Kentucky took in $354 million in tobacco taxes and another $117 million in tobacco master settlement funds, a total of $471 million. Of that $471 million, the state public health department was only given $3.7 million to prevent youth tobacco use and to help smokers quit. Not enough. And we also will be seeking to raise the legal age for purchasing tobacco products in Kentucky from 18 to 21. The Foundation also has produced 8 public service announcements that are airing on TV and radio stations statewide and in schools and public health departments and even in some movie theaters. We also have created presentations for schools, youth groups, PTAs, and civic clubs. One is for adults and one is for a youth audience. They're free and available on our website at healthy-ky.org. Separately, each of these efforts will have some impact, with the e-cig tax leading to the greatest reduction in e-cigarette use, especially among youth and pregnant women. But together, these policies and educational efforts will help reduce the risk of vaping-related lung disease in the short term, while also cutting our tobacco use rates over the long term. We look forward to working with lawmakers, schools, public health departments, and others to make that happen. But the thing that would really matter the most, we believe right now, is a flavor ban. We'd love to see that happen in Kentucky. We know the Trump administration has said that they were going to do it. They haven't done it yet. It'd be good if Kentucky went ahead and did it right now like some other states did. Thank you.
Our next speaker leads our Jefferson County Public School System. And before he comes up, I want to recognize my youth implementation team. So every year I have a group of young leaders around the city, mainly high school age, some early in their college careers, that represent all parts of Jefferson County in Louisville. Last year, the two initiatives that they worked on with us was the reduction of teen suicides, but then also making our youth aware of the dangers of using e-cigarettes and all vaping products. That led to a resolution that was passed by the United States Conference of Mayors this past July at our annual summer meeting. So it's a national policy right now urging all cities and all mayors to bring the issues about the dangers of using e-cigarettes to the fore, especially amongst our youth. So I just want to say I'm proud of our youth implementation team. The vast majority of them are with Jefferson County Public School, who is producing great leaders each and every day. And for that, we thank all of JCPS, but especially our superintendent, Marty Polio. Dr. Polio.
Good morning. It's an honor to be here, and especially to address this important topic and talk about what JCPS is doing to reduce the impact of vaping and e-cigarettes amongst our students throughout this county. So as the mayor said, it was about a year ago he called me, and he had just met with the students on his advisory council. And as they said, they had talked to him about education around vaping and then prevention of suicide. And as we all are all too often in schools, adults are way behind the students in what they're doing. And so at that point, we started talking about, is this a real issue? Shortly thereafter, I had a meeting with a board member Chris Brady, who is here, who also discussed with me about the importance of education and prevention when it comes to vaping and e-cigarettes. I had a conversation shortly thereafter with my daughter. I have a 14-year-old JCPS daughter. I'll take any prayers that you would like to give. But I had a conversation, because what we think of when we talk often about vaping, e-cigarettes, smoking, is the traditional high school student, the older student who might be doing it. My 14-year-old daughter told me about 8 months ago, she said, "Dad, there's a lot of middle school students all over the community, public, private schools, everywhere, that are vaping, and it's a pretty serious issue." And it was at that time that we knew in JCPS that we really had to take action and do something. Since then as well, we've had some real healthy discussion amongst our board, and quite frankly, some debate about education, prevention, even discipline, the appropriate steps to take. And it's been real healthy dialogue and debate. More than anything, it has brought awareness to the subject and the topic amongst our students and in our schools. And so since the time we were in this room, I believe it was back in April, back in the spring, when we launched our program, Vaping Equals, which is really surrounded by awareness and education for kids around vaping, we have seen a decrease in the use or the students that have violations of nicotine or e-cigarettes. So it's hard to say, is that, can we see causation? Is there a drastic reduction? We're not sure of that at this point, but we are seeing positive indicators to say that us bringing this issue to the forefront, talking about it, exposing it at the schools, making sure that we bring awareness that it is a significant health issue, because what we found is students didn't know. They felt that it wasn't a significant health issue. And most importantly, bringing Vaping Equals into the curriculum. The challenging part of bringing it into the curriculum is how quickly we are getting information and making sure that we are getting it to our teachers and our staff, so then in our health classes, in our science classes, that teachers can talk about the dangers of vaping and e-cigarettes. And with our website, Vaping Equals, that's on our JCPS website, there are a lot of things that teachers can use, resources that teachers can use to bring to their students. And so we show not only, we focus on prevention, we focus on awareness, and we focus on education. And personally, I couldn't agree more. with Ben Chandler's call to our legislature. We support that, and we believe those are very important steps, along with the mayor, to make sure that we keep our kids safe, and we will continue to look for new ways to make sure that we prevent this problem with our students in JCPS. Thank you.
Thank you, Dr. Polio. To speak a little bit more about the science behind the issue that we're talking about here today, we're fortunate to be joined by Dr. Aruni Bhatnagar, who's a world-renowned researcher in this area and also the founder of the Center for Enviromics at the University of Louisville. So please welcome Dr. Bhatnagar.
Good morning. When about almost 12 years ago, e-cigarettes were introduced, it was with the promise that they're going to help adult smokers quit. And that was the reason that they've been on the market and be the main argument of why we're still here with us today. For some reason, the promise did not fully materialize, and what ended up happening was the e-cigarette companies and the vape shops ended up addicting a whole new generation of youth to e-cigarettes rather than helping people quit. I would address 2 points. One is about their efficacy and cessation and the youth use. So we know that e-cigarettes are maybe twice as good as, say, nicotine gum or patches in quitting, and that's been shown in randomized clinical trials. But what's important to note here that they are not much better than already available pharmaceutical therapies and cessation therapies approved by the FDA. So they're not remarkably efficacious compared with other things. The second question is that if there is increased youth use, then we must figure out some ways in which to curb that. And the major driver of that has been the use of flavors. And so therefore, we strongly support the ban on flavors so that we can limit and curb youth use. But the important question, which has not been answered, is why this is happening now and what has changed. So, of course, no one knows. I've been talking a lot with both with the FDA this year as well as CDC. And the general understanding is that even though there are some contaminations, and for example, there have been a lot of talk about THC contamination of vitamin E oil, about 20 to 25% of the cases have none of such ingredients. And so there may be something intrinsically harmful in the e-cigarettes by themselves. So again, why is it happening now? It is because we have the use of e-cigarettes have spread. More people are using it. There are people who are sensitive to e-cigarettes, or nicotine or its ingredients are using it, so they would react to those. And then there is the frequency of use has increased. These cases are not happening in Europe, where the levels of nicotine are regulated to 1 to 2%. We have 5 to 7% nicotine in e-cigarettes, particularly Juul. In Juul, e-cigarettes contain nicotine acetate, which is salt that is not even present in combustible cigarettes. So because if you overuse combustible cigarettes, because they're so irritating, you get sort of a reaction that you stop using them. It's very easy to keep using e-cigarettes because they're not irritating. And so you can overdose on nicotine, and some of the symptoms may be due to nicotine. The other guesses that people have could be that because they contain things like glycerol and propylene glycol, which are used to generate theater fog and so on, inhaling that coats the lung with a sort of oil. And this oil prevents the exchange of air across the lung, causing these symptoms which we call lipoid pneumonia. So although these causes are being investigated, it's clear that we have to be cautious about the use of e-cigarettes. Certainly no kids should be using it, and even people who want to use e-cigarettes to quit from regular combustible tobacco may be better served by using the FDA-approved programs and call the hotline. In 2014, we issued a statement from the American Heart Association cautioning against the use of e-cigarettes and warning that there should be strict regulation. The FDA has been delaying this regulation, and the American Heart and other partners, and all of us have sued the FDA to accelerate their regulation so that we can have, if the e-cigarettes are going to remain in the market, they should be certified. At the very least, they should be able to disclose all the ingredients that are in that. And certainly, they deserve to be taxed at a rate equivalent to tobacco. Thank you.
Thank you, Dr. Bhatnagar. I want to thank the University of Louisville for contributing to all of this research and science. Also want to recognize Dr. Craig Blakely behind me, who runs the School of Public Health at the University of Louisville. So, in closing, there's a great deal we need to learn about what's causing this outbreak of lung disease, as you've heard today. But the safest decision is obvious, and that's just to avoid vaping and e-cigarettes, particularly amongst young people. So parents, please talk to your kids. Make sure they understand the dangers that e-cigarettes pose. Be very aggressive on these conversations. And as you all know, one of the pillars of my administration is to make Louisville a healthier community, and reducing the prevalence of tobacco use in any form is a central part to that, with good science behind it. So let's start sharing that message early and often with our kids. A next step will be a public forum on youth vaping in the Mayor's Gallery on November 6th from 4 to 6 p.m. So you'll get more information about that. So thanks everybody for coming out. If you'd like additional interviews, we can do that on the side. Thank you.